I'm Dr. Preetam Ganu. I'm obstetrician and gynecologist practicing in South Australia for nearly 20 years. In my obstetrics and gynecology practice over the last 20 years, I have seen that the heavy menstrual bleeding is a very, very common problem. A lot of the time, women even don't know that their bleeding is heavy, but they start feeling very tired, they are feeling exhausted, they have to take time off their work, and sometimes their iron levels are really low. They do even get iron transfusion. But the root cause of the problem is quite often very heavy menstrual period. So 1 in 3 women suffer with heavy menstrual bleeding. But the good news is that there are many different treatment options available. This can be treatable, this can be preventable. So it can be something very simple like a tranexamic acid tablet, which works on the blood clotting mechanism that can reduce amount of heavy bleeding, or something like hormonal tablets, or sometimes Mirena intrauterine device, which sits inside the uterus and works on the lining of the uterus and prevent the heavy menstrual bleeding. Or if you don't want anything hormonal and you have completed your family, there is an option of something called as endometrial ablation, where we burn the inner lining of the uterus and that stops the bleeding. In some occasions, there may be bleeding is because of the structural things like a fibroids or adenomyosis or endometriosis. In those situations, sometimes we need to consider operation like a hysterectomy that can stop the heavy bleeding. So there are many different causes and many different options, but important thing is to have that awareness and take the first step to look after yourself. I'm really glad that I would like to support International Day for Heavy Menstrual Bleeding organized by Bleed Better organization. Thank you.